Its outbreak in China has raised health concerns globally, reminding the world of what we witnessed 5 years ago when it comes to the COVID pandemic. Now, as per reports, it affects individuals across all age groups, right from young children, infants to the elderly and those with low immunity. And however, the center held a meeting on the 4th of January and keeping a close watch on the developing situation in neighboring China. Union Health Minister JP Nadda has reassured the public that it is not a new virus and urging them not to panic.
Health experts have clarified that HMPV virus is not a new virus. It was first identified in 2001 and it has been circulating in the entire world since many years. Joint monitoring group meeting was held under the chairmanship of Director General for Health Services on 4th of January 2025 to review the situation. The health systems and surveillance networks of the country remain vigilant, ensuring the country is ready to respond promptly to any emerging health challenges. There is no reason to worry. We are closely monitoring the situation.
The ICMR, or the Indian Council of Medical Research, confirmed first 2 cases from Karnataka's Bengaluru. First case of an 8-month-old male infant who is recovering in the hospital, while the second case is of a 3-month-old female infant who has been discharged. Now, both of the cases had a history of bronchopneumonia, where the infants and their family had no history of recent international travel. As these cases that have been discovered through routine surveillance, and following this, Karnataka's health minister also chaired an emergency meeting and assuring citizens that there is no reason to panic. However, there has been another case that has been reported, whether it comes to Maharashtra's Nagpur and in Gujarat as well, where a 2-month-old tested positive for HMPV.
It is found in 2 children. Immediately after seeing this, I talked to Mr. Dinesh Gundu Rao, who is in charge of the health department, and he responded quickly and he took up a meeting with the department, and whatever decision he takes, the government will implement it, and the government will take all precautionary measures to implement and to prevent.
I don't think we should be pressing the panic button, because HMPV is not a new virus, it is an existing virus. And the statement, the way report has come out that this is the first case of HMPV in India, which is not true, because HMPV is an existing virus and certain percentage of people do get affected by this virus, and it is not something new. And the baby, the child that has got affected, it has got no travel history, and they're all local people. They're not coming from China or Malaysia or some other country. So I do not think there's any connection to that. China's outbreak is, they are saying, is a new variant of HMPV. So that is what they are saying. We don't have the full details.
Now, let's tell you a little about this HMPV virus. It's a human metapneumovirus, which is a common respiratory virus, and it is not a newly discovered one. First, that it is said to be discovered back in 2001. In fact, some reports have suggested that it's been in circulation since 1958. It causes common cold-like symptoms, can cause respiratory diseases, and spreads during the months of winter and early spring. Now, as per the Health Ministry, HMPV is already in circulation in India. Then there has been no unusual surge that has been reported. However, there has reactions that come in from Delhi's former Chief Minister Arvind Kejriwal, who has called for the centre's immediate attention. In fact, Delhi's Health Minister Saurabh Bhardwaj has also directed his health department to make arrangements to handle any possible increase when it comes to such cases. But all of them saying that there is no need to panic, where cases that have been reported in different states, where high alert that has also been issued, as the states and their respective governments have been monitoring the situation closely, whether it comes to Maharashtra, Tamil Nadu, Karnataka, and even in West Bengal. Now, as more and more cases of this HMPV virus that have been detected in India, Group Editor-in-Chief Navika Kumar spoke exclusively with Dr. Bernadette Van den Hoogen, who is the scientist who discovered this virus, sharing insights into the virus's behavior and the ongoing global concerns. Listen in.
Dr. Bernadette, and my question to you is, first one that is on everybody's mind, this is not a new virus, we're being told, but how dangerous is it, And is there something that we should be worried about taking us back to the pandemic COVID-19 days?
Good evening. Thank you for having me. You had a lot of questions. First of all, the virus is already circulating for more than 60 years in our population worldwide. So there's not a new virus, and it's also not a threat for a pandemic. Every person gets infected before its 5th birthday. Everyone gets the virus. It's just a common cold. All children will run into this virus and have a common cold. It's not a dangerous virus. There should not be any worry about it. When you encounter the virus, you develop a common cold. And only very young children and elderly, and maybe with patients with underlying disease, might develop a severe disease. But it's not like COVID.
So let me ask you, we've already had 3 cases being reported in India, and these are in infants. Are infants more susceptible? Is this likely to be life-threatening at any of these times?
No, it's in general not life-threatening. And as I said, all children encounter the virus. All children are being infected in their life. It's not just this year. Every year there are epidemics. Just like all the other cold viruses, you get a runny nose and maybe a cough and a sore throat, and that's it. With children, they go through so many common cold viruses, and most of them just come through it pretty okay. And only in a number of cases, very low number, the children need hospitalization. But even then, it's not deadly, there's no concern. But everyone, every kid will get it. And the virus goes around every single winter. So the 3 cases you see now is like, there must be way more, because it's a general occurring virus.
So then why is there such a scare after social media has videos being reported from China? Is it the same virus in China? Is it a different strain? Because there is an emergency that has been declared in China.
Yes, well, I don't know the details from China, of course. But
nobody knows.
In general, it's the same kind of virus that spreads out over the world in the winter months or early spring months. And why China, and even China is not declaring an emergency state. They just see a rise in respiratory infections, not only with human metapneumovirus, but also other viruses, which is normal in the winter. We have a rise in respiratory infections caused by several viruses. Right here in the Netherlands at this moment, it's the RS virus. In China, it's metapneumo. And maybe China brings it out because they don't want to have the same guessing as was for COVID. They just bring out all their numbers right now. But it's not so severe what they see. And that's what they say themselves as well. They see a rise, but it's not severe.
Now, there's another update that has come across on HMPV, where the Union Health Secretary has reviewed the present situation of respiratory illnesses in the country and the status of public health measures of their management. However, there has been no surge in the country of respiratory illnesses. That is, the sturdy surveillance, would be carried out to detect such cases, and the states that have been advised to strengthen awareness among masses regarding preventive measures, and states who have been also advised to strengthen and review when it comes to the surveillance that is also being carried out. So, Akansha, mainly when it comes to the general precautions that one needs to keep in mind, surveillance that is also being carried out, closely monitoring of the situation that is also being carried out in several states. Akansha? Well, that's the update on HMPV that we are picking up, with the Union Health Secretary reviewing the current situation of respiratory illnesses in the country and the status of public health measures for their management, as several states, including Tamil Nadu, Maharashtra and other states, and Gujarat as well, have reported cases of HMPV. With that,